So here we go. I think it should be recording right now. All right. Hello, everyone. Welcome back to Sapiens Playground. Today I have a very, very special, very important guest on. It's Dr. Peter McCullough. Many of you guys have probably heard him talk on the Joe Rogan Podcast. So again, thanks a lot for coming on. It's a real honor to have you on.
Well, thanks for having me.
Well, Peter McCullough, maybe for those who are not that familiar with your work, maybe haven't heard you on Joe Rogan or on any other platform, if you mind to just give a brief introduction to who you are, what you do, and what's kind of your role in the whole situation that we are stuck in right now.
Sure, I'd be glad to. I've had some exposure to German audiences in the past. I've been on with Uwe Schlatter of Klartext, and it's a pleasure to join German and European audiences again. I'm Dr. Peter McCullough. I'm a practicing internist cardiologist. I'm trained in epidemiology. I'm an academic practice in Dallas, Texas. I'm well known among academic physicians. I have over 650 peer-reviewed publications in the National Library of Medicine. I focused on heart and kidney disease. I'm the editor-in-chief of Reviews in Cardiovascular Medicine, the former editor of Cardiorenal Medicine, the editor of the first textbook, the inaugural textbook, Cardiorenal Medicine. I have over 50 papers now since I've dedicated my efforts to COVID-19 over the last 2 years, 50 papers on the pandemic response, including the two seminal papers proposing treatment of patients with COVID-19 to avoid hospitalization and death. And so I've been asked to testify in the U.S. Senate now twice. I just recently came off a 5-hour Senate hearing, which I co-moderated under Ron Johnson in the U.S. Senate building in Washington, D.C. I was the lead academic presenter at the Lincoln Memorial crowd march to drop the vaccine mandates. And I've provided my testimony in multiple state senates. I'm a regular contributor on Fox News, Newsmax, OAN. And I think the reason why is because I've given accurate and correct information on the COVID-19 pandemic, particularly important inflection points. I was first year of the pandemic, I was a regular contributor in the print journal, TheHill. And the second year now I have my own podcast, America Out Loud Talk Radio, the McCullough Report, where I have given America and the world accurate information, cited information about the pandemic response, which is greatly needed.
Well, yeah, it's absolutely greatly needed in these times. And well, let's dive right into it, because there's a bunch of things that I would like to talk about with you. And so the first thing is one that you already mentioned right now. It's like the whole thing regarding early treatment, and that's what we would probably agree on is something that has been actively or not, willingly or unwillingly, we really don't know, but disregarded in the entire 2 years of management, so to speak, of the pandemic. And so one thing that I've been really curious about is what's your explanation for why treatment hasn't been really pushed that much or implemented in this entire time. So there's been actually a real backlash against treatment, saying things like, anyone who pretends that there's a cure for COVID or that there's a treatment for COVID should be like banned or censored for spreading misinformation. So why do you think we have something like that actually going on? Whereas you would actually think that if we are in such a terrible situation as a pandemic, we would try everything possible and every possible medication to actually treat patients.
Sure. I mean, that's been the shortcoming, and that's what I told Americans this last weekend. The shortcoming is none of the governments and none of the government public health agencies have given a full-throated support for doctors to do all they can to prevent hospitalization and death. And the fact that our government agencies fail to support doctors, I think historians will record for decades to come in the future. It's a giant mistake not to support the doctors when they need that support. They need full support to use an entire range of medicines that they deem in their clinical practice can help patients avoid hospitalization and death. This is a respiratory illness, and it's an illness that forms of this illness, doctors have managed for years, but they do need full support for this. And if doctors have found that certain combinations of drugs are particularly successful, and there's a signals of benefit, acceptable safety, then the doctor makes that decision. The doctor under no circumstances should receive any negative communications on early treatment, should have any impediment to implementing top of the line care. In the United States, we now know that the nasal virucidal washes are very effective. We're using this first line now. That's using dilute povidone iodine, dilute hydrogen peroxide. Takes about a half a teaspoon in a shot glass of water. Squirt it up the nose, sniff it back, and spit it out. That's with povidone iodine. Highly effective, done 4 times a day. Dramatically reduces the risks of progression of disease and hospitalization by over 70%. 12 clinical studies show that. We have now a dilute hydrogen peroxide, about 3/4 of a teaspoon, a shot glass of water, 1.5 ounces, same process. So virucidal treatment has yet to be even mentioned by any public health relief agency. It's widely used across India, Bangladesh, elsewhere. It's widely used in the United States. It's part of the Association of American Physicians Home Treatment Guide, for instance, part of the McCullough protocol, which is a copyrighted protocol now. So we use that first line. We use nutraceuticals, including zinc, vitamin D, vitamin C, quercetin, over-the-counter antihistamine medication called famotidine. And then we can use monoclonal antibodies. In the United States, we have the GlaxoSmithKline sotrovimab. It's the one that remaining that covers Omicron. It's highly effective. It can be used down to age 12. And then we have oral antivirals, including hydroxychloroquine, ivermectin. They were used primarily in years 1 and 2 of the pandemic, but now we have Paxlovid from Pfizer, the new molnupiravir Merck drug. So we have many oral drugs. We add as needed intracellular antibiotics, inhaled steroids, oral colchicine, aspirin, and anticoagulants. But the idea that our public health agencies would not promote these highly effective treatments, drugs used in combination now, my estimate is 95% of hospitalizations and deaths can be avoided. And there are no clinical trials putting all these drugs in combination yet. So this is far ahead of the clinical trials. This is common in medicine, where doctors figure out an approach long before the clinical trials catch up to clinical practice. But our agencies to this date are only promoting one thing, and that's the vaccine.
Well, that's probably the question. Like, why is it just to promote the vaccine? It's just to get people vaccinated, or why should everyone disregard treatment? And actually, why should there be that backlash against treatment? Like, the claim is, well, there's no evidence. I'm absolutely against these claims, because as you mentioned, everything that we have should be used to treat patients, and especially if we have evidence that it might be very, very useful. But the claim is there is not enough evidence, or the evidence not clear. And then there is like people who try to say that, or doctors who try to claim that there might be harm associated with it. So you might do harm to patients. So what's your response to that?
I can tell you there are dozens of papers with the monoclonal antibodies. They're safe and effective. They do not cause harm. I've looked at it carefully. And those doctors claiming, in fact, there's not enough evidence to use monoclonal antibodies, they're going against the federal agencies. Even the federal agencies have given them emergency use authorization. They're really wonderful agents. There's no doubt about it. Same thing for the Pfizer and Merck drugs. They have full EUA approval. And the Pfizer drug, which is a novel chimeras like 3 inhibitor plus ritonavir, an older protease inhibitor, has to be given twice a day. It's a bit cumbersome in terms of its dosing, but it was associated with over 85% reductions in hospitalization and death. So doctors that are arguing against the use of Pfizer or against the use of the Merck drug, about 30% benefit with the Merck drug, at this point in time, they're simply spreading misinformation. They're harming patients who need treatment.
Well, what's the thing with the whole ivermectin story? Because that was like a whole controversy in and of itself. I remember the time when Joe Rogan posted his clip, where he was telling all the things that he used to treat his basically his COVID case there. So when he got COVID, and the media actually they didn't say anything about anything that he mentioned, in spite of only about ivermectin. They only try to catch him on like ivermectin and say, he's promoting that horse dewormer drug. So why are people so why do they try to, again, maybe monoclonal antibodies, there's lots of evidence. People continue to say that we don't have enough evidence for ivermectin, even though that would probably not be a strong enough argument to say that we should not try ivermectin and treat patients, because it still might help, and they still might be some evidence which point into that direction.
Well, there's a historical context. When we first started in the pandemic, and I was very involved in pandemic response, the very first drug we had was hydroxychloroquine. And over time, hydroxychloroquine did amass over 300 supportive studies, where the benefit is about a 25% overall clinical benefit. So it's moderate.
Right.
Next came ivermectin. Don't forget, hydroxychloroquine and ivermectin came before the monoclonal antibodies and before the Merck and Pfizer drugs. This is natural in medicine, that there's a historical progression. Ivermectin, there's over 60 supportive studies, about a 70% benefit. Then we have the monoclonal antibodies that came in. We had the Lilly product, bamlanivimab. The alpha variant quickly became resistant to it. So did the South African variant. So then it was pulled off the market, reintroduced with a combination of erdafitinib. That was the Lilly product. We had the Regeneron combination product of casirivimab and imdevimab. That was our mainstay throughout. And then we have most recently sotorivimab by GSK. So these products went through an evolution of testing. And then we had inhaled budesonide, 3 supportive studies, 1 large clinical trial, the STOIC trial, over 80% reductions in hospitalization and death. We have the oral steroids meta-analysis, about a 30% mortality reduction. And then the Corona trial for colchicine, the largest prospective double-blind randomized trial, is actually with colchicine, where there is a statistically significant reductions in hospitalization and death. So we have a broad base of drugs. We have a broad pharmacopoeia. Why certain individuals picked out just 1 or 2 drugs? In the first year, they picked out hydroxychloroquine and, in a sense, tried to politicize it. Well, hydroxychloroquine wasn't the linchpin to treatment. And then in year 2, they tried to pick hydroxychloroquine. In fact, it's been so perverse with with ivermectin. I'm sorry, it's so perverse with ivermectin that the American Medical Association in the United States, which is a physician political action committee, has launched a campaign to abolish the use of ivermectin. Abolish the use. Now, this is used first line in Mexico, South America, India, Japan. It's widely used in the United States. So why hydroxychloroquine, and then why ivermectin as almost points of contention, while all the other drugs were continued to be used? It's interesting that Dr. Chetty in South Africa, Dr. Eugenia Barentios in South America, they came up with treatment protocols that don't use ivermectin hydroxychloroquine. So the question is, well, what do the naysayers have to say then? We don't need it.
Well, that's super interesting, and I don't know how things will continue to develop in regards to early treatments. But yeah, let's move to another sort of area of topics. And so that's basically all the false premises and misconceptions that underlie the pandemic response. And I've received some questions from, and also questions that I've been asking myself in regards to what the whole thing was based upon. And so basically many things that we do, like all this mass testing and masking of people and say social distancing and lockdowns, etc., is based on the premise that there is this thing as asymptomatic spread. So you can be asymptomatic and don't feel anything, but still spread COVID. So how legit is that? How real is asymptomatic spread? Because that's what people already accepted. It's like something, and that's why we should do testing, because you can be positive and not even know that you're positive, and then you spread the virus and infect everyone.
It was a preconceived, pre-baked false narrative. There's never been a disease in the history of mankind where someone is asymptomatic and they give it to somebody else. It's always symptomatic to symptomatic for a respiratory infection. So it was a false concept that was put out there and accepted. In fact, there were papers published, modeling papers, estimating that 30 to 50% of the spread was asymptomatic. It was all completely false. 2 key papers, one by Cao, 10 million Chinese, one by Madewell, clearly demonstrated. Asymptomatic spread is negligible. It basically doesn't happen. That means all this masking and lockdown was fraudulent. It was all based on a false assumption that was put out by public health agencies. It means that all this asymptomatic testing is fraudulent. In fact, the agencies know that. You know, the FDA has never cleared a test for asymptomatic testing. Neither has the EU or any other authority. Asymptomatic testing is a complete overreach over regulatory law. Yeah. In fact, it just generates false positive results for asymptomatic testing. There's never been a scientific study supporting asymptomatic testing. And so it should absolutely positively be dropped. Right. Asymptomatic testing should go away as we know it right now. It means never take a test to get on an airplane or cross a border. The World Health Organization says don't do it. It should be banned.
Well, yeah. But, you know, to maybe play some devil's advocate here, which I'm continuously going to do because I think that's maybe important for those to hear for those people who used to still maybe hold on to these premises. So what about that? What about incubation period? You know, because there's probably such thing as you can, or is it a thing that you might be infectious before actually developing symptoms, and so that, you know, that's where you might be asymptomatic basically before you actually start developing symptoms, and so how would you then distinguish that from an asymptomatic case who tests positive but actually never moves on developing symptoms in the first place?
It always has to do with the perceptiveness of symptoms, whether it's a runny nose, nasal congestion, sore throat, fever, virus. It has to do with perception of symptoms. If someone feels completely well, they can't spread it. But as soon as they start to have symptoms, then they can spread it. You know, Joe Rogan and I talked about this because when I went to his center, we had both recovered from COVID. So I said, Joe, why are we taking a test? He said, well, because, we have an insurance policy. I said, well, that's a dumb reason. Why don't we be smart and not take tests if we don't have symptoms? We've already recovered from COVID. He didn't have a good answer because he knew I was right. And then he used the example. He says, well, one of my friends, we were playing pool with him and he thought he was getting sick. And in fact, he spread COVID to everybody. I said, well, yeah, that's because he's symptomatic. So we just need to call a spade a spade. When people are asymptomatic, they can't spread it, period. And so we need to end this madness. Now, if people feel sick, they should stay at home.
Right. So, and that has been the rule for forever. Like since disease exists, it's had always been the most important rule. If you're sick, then stay at home and don't get outside. Okay. So another thing that I've already mentioned is the whole mask thing, right? So, there's allegedly been conflicting evidence on masks, and there's been this back and forth thing, and at least it was the case here in Germany, where authorities were first saying, well, masks are sort of effective, then no, they're not, and it's been going back and forth until now we have mask mandates everywhere. And so what's the thing with masks? Because even if we might, just from a sort of intuitive perspective, people might say, well, but I'm covering my face, or at least less particles are coming through. So wouldn't it even help a little bit?
Well, I mean, we could take some examples. If two people do not have the virus and they both are wearing masks and they both take off their masks, but they don't have the virus, there's obvious the virus can't spread because they don't have the virus. So it should be clear to people that if they don't have the virus, a mask can't possibly help.
Now, let's again, based on the idea of asymptomatic spread, probably.
Well, let's just say they just don't have it. If they don't have the virus, if you've got 500 people in a room and they don't have the virus, it's impossible for masks to ever do anything. I mean, I think everybody would agree, right? So the issue is, what if one person has the virus and they have symptoms? Well, in fact, when they start to cough, the virus moves right through the mask. The mask only filters out about 300 microns. The virus is 100 microns, so it easily moves outside the mask. Mask expert Stephen in the United States has done all the experiments. About 18% of the air moves around the mask. So all the experts would agree that once somebody is sick with the virus is going to come through the mask and it's going to go around the mask. So it should be obvious by going through this line of thinking that masks won't stop the spread of the virus. They won't. Now, I'm a cardiologist. I'm a doctor. I'm in the hospital. I wear a mask because I could be working with a patient and I may cough or sneeze and it may stop droplets from landing on the patient, mainly out of courtesy. That's fine.
Mm-hmm.
But shouldn't it be obvious now? Shouldn't it be obvious that masks don't stop somebody who's sick from spreading the virus outwards? It should be obvious now.
Right. Yeah, that's a good point. So the next thing would be probably the whole thing regarding lockdowns, and that's been a very hard, issue for me at least to take, because I've been seeing all the harm that lockdowns produced, especially for like children, and even without the children probably recognizing that the lockdowns will produce lots of harm to them, and so people lost their jobs and encountered various psychological issues. And so but people might say, well, lockdowns clearly have to work because you lock yourself down, you don't have contact with other people. But that would probably be the first question: do lockdowns actually work? And then does that even mean anything? Because if the harm that lockdowns produce is so much greater than the potential benefit, then should we even be thinking about implementing them in the first place?
Lockdowns would work if you lock down the right people. The people to lock down are those acutely sick with the illness. Remember, when you're acutely sick, they can spread it to others, and the masks don't stop the spread. So it's clear those sick with the virus should be in lockdown. They should be in quarantine.
Right.
The only question is, how long should that quarantine go? And our CDC has recently dropped it from 10 days to 5 days for asymptomatic people, but we use it the same for symptomatic, provided the last 2 days there's no fever. So lockdowns do work, but for the small number of people who are acutely sick with COVID-19. Again, what we're doing here is we're just applying common sense.
Sure.
Common sense, right? If we lock down 500 people that don't have the virus, it's not going to work, right? Because they don't have the virus. So all we have to do is apply common sense, and then we can navigate through these simple pandemic measures.
Yeah, and otherwise we'll produce, just as we said, we produce more harm, and we'll actually destroy society this way, because people are not going to be able to see each other and to work and etc. And again, this is probably, everything, masks and lockdowns, all these measures are all based on the idea and assumption that asymptomatic, people who tested positive asymptomatic are just as dangerous as sick people. That's probably kind of the biggest issue at work here. And so another question, moving on to the next question, is what do we now know about Omicron in general? Okay, so you've been talking a lot on the Joe Rogan podcast, which actually already also surprised me a little bit, as you tried to explain how it's not possible to get reinfected. So now, has anything?
This is a part of science. I went on Joe Rogan December 8th. December 10th, the news broke that you could get COVID-19 a second time. So it's simply a matter of timing. If I would have went on Joe Rogan December 10th, I would have told Joe Rogan you can get COVID-19 a second time. So it's pretty obvious that Omicron has broken through natural immunity. It also has broken through vaccine immunity. Omicron arose in the vaccinated on the border of Botswana, as it's reported out of South Africa. Omicron's the most highly mutated form of the virus. It doesn't invade the body nearly as much because it's mutated in the receptor binding domain. It's a mild form of the virus. It replicates 70 times faster than Delta and provides back immunity against Delta. So Omicron competed against Delta and won because it can replicate so much faster than Delta, and it closes the immunologic door. So now in the United States, we're 98% Omicron.
Right.
It's broken through both natural and vaccine immunity. And now this is part of science. I mean, the day this news broke, I got on national TV and I explained it. But people always said, "Aha, you said this," and they want to make a big deal about it. Say, "Hey, listen,
Right.
the science changes, and that's what we know."
Right, and I actually that was why I was bringing that up now, so that you can make that point clear. And I really appreciate you explaining that because yeah, and also basically agreeing, that it's important and it's good actually to that your views might change, and that's actually part of science, and that's a good thing. And so that's what's happened. And also probably back then, the claim or the careful assumption you made, that wasn't a claim at all per se, but an assumption that Omicron was sort of an evolutionary mistake, and so that would probably not apply anymore, because as you explained, there are some advantages, if you will, in comparison to Delta, right?
Right. I initially thought it could be an evolutionary mistake because it simply couldn't invade the body nearly as much and have an existence. But once the news broke out of Hong Kong University that it could replicate 70 times faster, that it became obvious it actually had an evolutionary advantage.
Yeah. Okay. Awesome. So, and would you think that it will be possible to finally reach herd immunity with Omicron? Because as you said, Omicron was able to basically move past natural immunity acquired from Delta. But now how is it going to work? Did Omicron develop as a vaccine escape variant, and so is it something that that might spread now because it's spreading so quickly in almost every case is Omicron now, and will it provide actually sustainable natural immunity that might help us get through that pandemic more quickly and end it sooner?
Well, it was clear with the first vaccine escape mutant was Delta. And Delta clearly escaped the effects of the vaccines. It was shown by Fahrenholt, Venkatakrishnan, Hedemaki. I mean, many authors showed the vaccines could actually be beaten by the Delta variant. So we've had the Delta outbreak through most of 2021. The vaccines had very poor coverage. A paper by Young Zhu and colleagues published in JAMA showed that in high Delta areas, there was only 20% vaccine efficacy. There were papers by Reimer-Risma and Acharian showing that the viral load of Delta in the nose of somebody vaccinated was equal to that of somebody unvaccinated. So it was clear the vaccines weren't sterilizing Delta in the nose and mouth. And that's the reason why there were so many Delta cases as the vaccines failed. One of the big examples of that was Israel, where Israel was fairly reporting the data, and there was far more people fully vaccinated with boosters getting Delta than the unvaccinated. And now with Omicron, it's clear by the UK Public Health Security Report, a paper by Hansen, that it's clear that Omicron is simply not covered by the vaccines whatsoever. There's been a few papers, one by Colley in the New England Journal of Medicine from South Africa, and the CDC has a bundle of papers that I think incorrectly try to demonstrate that the vaccines or boosters have protection against Omicron. And the reason why they're flawed is because they're not randomized. They're based on hospitalization data where the hospitalizations are not adjudicated for if they have a respiratory illness or not. And not only that, but there's differential testing applied. So the unvaccinated get a lot more testing than the vaccinated. So all these hospitalization claims that the vaccines protect against hospitalization, in my view, are not valid. And we know that because in the UK, Denmark, Germany, and South Africa, far more patients fully vaccinated with boosters are sick with COVID-19 than the unvaccinated. So the vaccines have basically backfired.
Well, one question that comes to mind now is, does it then actually make any sense to vaccinate or do like mass vaccinations against a respiratory virus? Because you might say, well, what actually happens is that because the the virus will just keep producing vaccine escape variants, and we'll actually never be able to develop a sustainable, long-term, effective herd immunity. And so, it will continue to happen this way. So
yeah,
what's
it's
your take on that?
ill-advised. It's ill-advised to have indiscriminate vaccination against a widely prevalent respiratory virus. It's a giant mistake. Experts told public health agencies way ahead of time, don't do this. This is a giant mistake. The virus will just mutate. It's obvious. There was warnings. I published an op-ed in TheHill before the vaccine data even came out, making the case that the vaccines were a giant gamble. Now, if we would have just had the vaccines to protect the high-risk seniors, that would be along the lines of the Great Barrington Declaration. Just protect high-risk seniors and nursing home workers. In the United States, that meant probably fewer than 3 million people who got a vaccine. And let's say it was safe and it did work, that could be done. But to try to widely vaccinate, and it's just carried to just extremes, vaccinating children and other people, it's been a disaster. There are 3 analyses, one by Subramanian, one by Kampf, and the last one by Beatty, showing that mass vaccination is backfiring. Everywhere where there's high density of vaccination, like Germany, it's worse. You have more cases, more mortality. The vaccines clearly don't work and they're backfiring.
Well, we see it in Israel right now, right? They are like doing the 4th shot, giving the 4th shot to everyone right now. And I think they have now one of the highest numbers of cases in the world. So we're clearly seeing it actually going in the opposite direction. So that's an interesting thing.
Well, there's no, put it this way, there's no signals that mass vaccination is working at all. Zero. There's nothing to support mass vaccination. In fact, I think they should be dropped altogether. Take them off the market, and then we'll just treat the high-risk people, because we're just going to produce more mutant strains. Omicron is very mild. If we stopped here, we're on the backside of our Omicron curve. I think Germany is too. There's not going to be that many more cases. If we quit the vaccines right now, we probably could get out of this. But if we continue to vaccinate, we'll have more mutants. And there's even a new mutant called the Omicron subvariant BA2 that's on the horizon. It's like, it's all because of vaccination.
Well, I'd like to ask you a few more questions on the vaccine, but before coming to these questions, I just want to go back to natural immunity for a second and tell you a funny story that's going on here in Germany, because what's happened in Germany recently, which is hilarious, which is it's I don't know if I should be extremely angry about it or just laugh about it, because it's such a ridiculous thing. But it's they decreased the validity of the document which you acquire if you have recovered from COVID, right? They have shortened its validity from 6 months to 3 months, saying basically natural immunity is a thing for 3 months. Before it was 6 months, and now it's 3 months. Whereas like in other countries, like in Switzerland or Sweden or Russia even, they prolong that to a year. And so that's so ridiculous, because it's every other country is doing like prolonging the natural immunity passport, or however you want to call it, the document, and saying, okay, like natural immunity is probably a real thing and it lasts for longer than 6 months. And now Germany comes and says, well, we're gonna cut it in half and say it's only 3 months. So and I don't know, for people who are maybe not really sure what's going on, what's your take on natural immunity?
Natural immunity, because the virus is so similar to SARS-CoV-1, it's basically, it's permanent. It's permanent. So SARS-CoV-1, there's 17 years of immunity. There's been 140 studies supporting natural immunity in COVID-19. It's not time limited. It's not 6 months or a year. And so to put arbitrary time limits on it is not scientifically supported. I think putting time limits on it is trying to promote dangerous over vaccination, because if someone is naturally recovered, they take a vaccine, all the studies show it's dangerous. It causes harm, and there's no opportunity for benefit, just an opportunity for harm. So I think these time limits are arbitrary and capricious.
Yeah, well, I absolutely agree, and I hope things will change here. And at least, like, I also don't like these arbitrary cutoffs, like saying it lasts for 3 months, 6 months, whatever. But It's like to go to places here in Germany, you need to either be fully vaccinated or you need to have that document which proves that you have recovered from COVID. So, and that's where it's being used. And it's like now taking hope from those who actually recovered from COVID and thought that they would be now free for at least 6 months, and now they actually, got the information that it's not only 3 months. So I hope this will change in the near future, hopefully, because there's no evidence.
Now remember, if let's say there's a coffee shop in Germany, and they only let in people who are vaccinated. Remember, a paper by Singarajam and colleagues published in Lancet, careful case contact to trace and study, shows 39% of transmission is from fully vaccinated to fully vaccinated. So you can see how requiring vaccines to go into public places just promotes spread of the virus. It's not going to work. It's probably going to worsen the pandemic. So you can see how ill-advised and imperceptive these public health policies are.
Well, absolutely. And one question that I was thinking about, where that whole narrative was going on, at least here in Germany, that the pandemic and the cases is driven by the unvaccinated because they spread the virus and they are so dangerous. So one thing that I was thinking about is, is it possible, and that's what I wanted to ask you, because I didn't really find some clear mechanistic evidence or something that would support that. So I would like to ask your opinion on that. That vaccinated people might be able to transmit higher viral load without actually having the same magnitude of symptoms compared to an unvaccinated person, because the vaccine is basically, shedding the symptoms and making them less, profound, so to speak. And so then the vaccinated person doesn't know that, or doesn't clearly know that he or she is sick or sick enough. And then it still has a higher viral load compared, say, to an unvaccinated person. And so is that a reasonable idea?
I mean, it's possible. It's just not supported in the evidence. The papers that have measured viral load are Chow, Reimerisma, Acharian, most recently Accorsi. Accorsi in JAMA measured those who've gotten 1, 2, or 3 shots, both Delta and Omicron. And it's clear the vaccines have no impact on the virus, none.
Right.
So the viral loads in the nasopharynx are the same. So when they do become symptomatic, they equally spread the virus. Right. So there's absolutely no scientific support for a vaccine passport or to have a business that only lets vaccinated in. None. So it should be dropped immediately. Vaccine passports should be dissolved. And vaccine mandates should be dissolved because there's no scientific support. And it's obvious the vaccinated are spreading it to one another.
Yeah, and now moving to vaccines and vaccine safety, because we've already touched on that whole issue. I've had some interesting conversations with my fellow, or at least, I can remember with one fellow medical student about, the discussion about should you get the vaccine or not. And one argument, that's accepted, or was at least accepted back then, was we don't clearly know everything about vaccine safety, and that's definitely something that we will be talking about today with you. But and so he accepted that concern, so to speak. But another thing that he was always bringing up is but it's not only about you. It's you protect others, right? So when you take the vaccine, you protect the healthcare system from being overwhelmed by sick patients. And also you protect your grandmother or whatever from, back then I tried to explain that issue with vaccinated people actually having the same viral load as unvaccinated people. Probably back then it was half a year ago or something. There was probably not that much evidence to back that up, but I think right now there probably is. But again, what would your response be to such a claim?
Yeah, that's a false claim. Taking a vaccine doesn't protect anybody else, since the vaccines don't stop spread of infection. Fully vaccinated people spread it to one another. Being vaccinated is not protecting anybody at all. And there's never been any support for that claim. The only reason to take a vaccine is to try to reduce the binary occurrence of COVID-19 respiratory illness. That's in the regulatory package of all the vaccines. The claim that the vaccine manufacturers have is that they reduce the binary occurrence of COVID-19 and respiratory infection. Even in the Pfizer program, there was no reduction in death or hospitalization. The entire Pfizer program, in the dossier, there were 21 deaths in the Pfizer vaccine group and 17 deaths in the placebo group. So we knew from the very beginning that Pfizer did not reduce death or hospitalization. And so the claims that vaccines reduce hospitalization, I think they're invalid.
Oh, interesting, because like that was something which at least I, kept considering as somewhat of a valid argument, saying like that it at least reduces severe or the chances of developing a severe case, because that was like for the past whatever 1 year or so, it was the main argument. It's it prevents severe illness. So you say that's not the case.
It never was shown in the randomized trials. Again, that became an imaginary argument, just like asymptomatic spread and just like vaccine stopping spread. These are just false narratives that came out of our government agencies. You remember, we've had false narratives from the very beginning, and this one's another one.
Well, interesting. So another claim. Well, that claim we've already discussed. Okay, so now let's maybe talk about the issues or concerns regarding vaccine safety, because that's, I think, a topic which is, I think it should be less controversial, and there should be so much more actually freedom and space to be able to talk about it. That's a thing that I've heard also Dr. Robert Malone speak on that topic on the Joe Rogan podcast, and one thing that he brought up, which very highly resonated with me, was that it's not that you have to prove that medical intervention is not harmful. You actually have to assume that it is harmful in the first place, and then you should need to take steps to actually prove that it's not harmful, and not the other way around. And so people still shut down any voice that tries to raise concern on that whole issue. And so I just want to go through these things. So one issue that is very which has been talked about recently a lot was the whole myocarditis thing. So what's the magnitude of this side effect? Because there are various claims, silly or not. It's like, these are all mild cases. These are very rare cases. I've been talking to a doctor recently, and she's been telling me that the risk of getting a severe case of myocarditis after COVID is actually much higher than after the vaccine. So the vaccine is still better than COVID. So there are all these claims. And so what would you say on all of that?
There's been all these attempts to try to normalize the catastrophic outcomes of the vaccines, and none of them are valid. In fact, most of them are just unethical, immoral to even propose. I'm going to read to you the CDC Vaccine Adverse Event Reporting System data. Now, this is a gross underreporting of what's going on. Right. This is underreporting, but these are validated cases. These are ones, 86% of the time, these are reported by doctors, nurses, healthcare personnel, and who are concerned the vaccines cause these problems. That's the reason why they were put into the system and verified. Keep in mind, 50 deaths, typically a product is taken off the market, a widely used product, 50. 5 get a black box warning. You know how many deaths we've had in our CDC VAERS system? 22,193 people sadly have died a few days after taking the vaccine. We have over 300,000 individuals. 300,000 individuals have been hospitalized, urgent care visits, office visits. We've had 39,150 people permanently disabled. We've had 27,674 cases of myocarditis, pericarditis. It is not rare. We have papers on myocarditis. Now there's 200 peer-reviewed publications on vaccine-induced myocarditis. That should tell you something. Our FDA says that Pfizer and Moderna caused myocarditis. This is not controversial. It causes myocarditis. The most recent estimates are by Scharf and colleagues. The peak age group could be your age group, is age 18 to 24. It's between 400 and 500 cases per million. 90% are
Right.
in men. I've published with Rose and colleagues that the risk extends up to age 50 in men. This is catastrophic. This is not controversial. The respiratory infection doesn't cause myocarditis. That's been disproven in a paper by Joy and colleagues. Doesn't cause clinical myocarditis like the vaccines do. So these are attempts. People are saying these things to try to normalize what is just an awful, catastrophic outcome. People losing their lives, being permanently disabled, being damaged with the vaccines is absolutely unacceptable. This is like a war. This is like a war that's happened in America. Now these people, we have 1,053,828 full safety reports in 200 million people who took the vaccine. The people who take the vaccine basically regret that they took the vaccine. There are so many injured and damaged people after the vaccine. The myocarditis, the vast majority of the kids have to be hospitalized. They need treatment, medications. They have to be taken out of sports for months.
Right.
Marathoner Fabian Trump from Switzerland, told local reporters she took the vaccine and boosted. A young person like her doesn't need to take the vaccine because COVID's so mild. Young person like you, COVID is less than a common cold. There'd be no reason for you to take a vaccine. She takes the vaccine. Now she can't run. She's got myocarditis. She's out of contention. We have record numbers of European athletes dying on the field with cardiac arrest. About half of them do not survive. Now, we don't know if they've disclosed if they've taken the vaccine or not, but it's very suspicious. The highest rate of death is from a paper is estimated by Pantazatos and Seligman and colleagues from Colombia. They think with the U.S. program, we may have had up to 187,000 Americans now who've died after the vaccine. That's based on the census data and the vaccine administration data. I mean, that's catastrophic. Americans have seen their loved ones die with the vaccine. That's the reason why people are protesting. In Canada, they're trying to shut down the country with the truckers. There's protests on Sunday. There's protests in the United States, but all across Europe. People are protesting because they know they can die with the vaccine. I mean, that's the reason why they're protesting. If the vaccine was safe and effective, everyone would take it. It's obviously not.
Yes, and it's very important points that you discuss here, and it's actually been the reasons why I've been concerned with the whole vaccine thing, because I'm in that category. I'm 18 years old and I'm very active, so I'm training a lot, doing lots of exercise, and so okay. But moving on to another issue, another topic that has been coming up recently was possible connections with this repeated booster and vaccine application and long-term damage to the immune system. So is there any possible connection?
The World Health Organization has brought that up, that repeated boosters, since the boosters don't cover Omicron, there's no randomized data showing that boosters would even have a hint of covering Omicron, that giving boosters, since it doesn't cover COVID, all that's going to do is potentially damage the immune system, because with each vaccination, there's an installation of the spike protein. Now, remember, the spike protein itself is a dangerous part of the virus. These are genetic vaccines. They harness a mosaic of cells to produce this abnormal protein. The vaccines go into the brain, the heart, the other vital organs. They cause blood clotting, damage blood vessel cells. And so the vaccines themselves have a dangerous mechanism of action. Now we've learned, paper by Bruce Patterson, paper by Banzel and colleagues, the spike protein is installed in the human body, both the S1 and the S2 segment, after vaccination, probably for over a year. So with each shot, you have a year to clear out this foreign protein. No wonder people feel bad after taking the vaccines, but then keep taking boosters. The spike protein continues to accumulate with no hope of getting it out of the body. So from a biologic perspective, it's an unqualified disaster.
And so that probably also explains the possible link with increased autoimmunity, because I've heard from friends, or at least there's one friend who works in a hospital, and she's been telling me that she's been talking to some immunologists, and they've been telling her that there's been many more cases. And one fellow medical student has told me that on one occasion in university, the professor has introduced him to a cause of Guillain-Barré syndrome developed after 2 shots of the Moderna vaccine. And so that might be a reason, because the spike protein actually accumulates in places where it doesn't belong to. Is that plausible?
It's true, although the Guillain-Barré syndrome is seen high with the adenoviral vector vaccine, so just the adenoviral vector itself potentially can cause Guillain-Barré. But remember, for young people, one case of myocarditis is too many. Remember, one case of Guillain-Barré is too many. An analysis by Hogan colleagues shows that a young person your age, you're far more likely to be damaged and be hospitalized with myocarditis than ever be hospitalized with the respiratory illness. That a paper by Kostev and colleagues shows you're more likely to die and lose your life with the vaccine than take your chances with the respiratory illness. And that's before Omicron. Omicron is so mild. I mean, no one would take a vaccine and risk death in order to prevent Omicron. These are bad trade-offs. The data are clear right now.
Yeah, that's very true. And so, people are, or at least many of those who have been somewhat concerned with the mRNA vaccines, there are maybe, some of them have been saying that, well, maybe I'm going to be waiting for some non-mRNA based vaccines, like these protein-based vaccines, Novavax, and what have we? I think there was Valneva or so. And so these vaccines have another mechanism of action. And so would you say that these might be a safer option for those people, or in general? And, would that be something that someone would consider to take if they would have to, like, if that would be on the market? So what's your opinion on these other vaccines, which are not mRNA based?
Right. So the antigen-based vaccines have the same shortcoming as messenger RNA vaccines. They're coded against the original Wuhan spike protein, which is now obsolete. So we don't know if the new vaccines would even cover Omicron. Omicron is so mild that I think a vaccine at this point in time is obsolete.
But what about the dangers? Like, would they be at least, like we all know, and you've probably explained why, in general, vaccines against a respiratory virus like COVID wouldn't probably do much in terms of stopping and basically dissolving the pandemic. But would it be less harmful, in your opinion?
It's potentially less dangerous, that's for sure. I reviewed the data package for the Novavax vaccine, where with the legacy variants, it was about 90% effective. So as good as Pfizer, Moderna. Caused a sore arm. In fact, the arm was sore, more sore than with Pfizer, Moderna, but less systemic effects. It's a limited amount of spike protein, but boy, they even have to change those vaccines. The virus is just mutating too fast for vaccines.
Right. All right. So, before wrapping up, and I've so many more things I would actually like to ask you, but we're kind of running out of time here. And some final questions before we finish this podcast, which I've been asked by some of my followers. And so one follower asked, what about quercetin? Well, I know it's quercetin, whatever it is pronounced. Have you heard of that?
Yeah, we do recommend it.
Is there any validity in using it?
Yeah, it's a polyphenol supplement. There's some mildly supportive data for quercetin, 500 milligrams twice a day. There's better data for vitamin D, 5,000 international units a day. We increased that to 20,000 units a day for treatment. Zinc, recent paper out of Florida, is zinc preventively, 50 milligrams of elemental zinc. There's support for all of those, even pre-hospital use of famotidine, which is an antihistamine peptide or famotidine, 80 milligrams a day. What I've just described is called our nutraceutical bundle. Those are available over-the-counter products that work well in addition to the oral nasal washes. With Omicron, we rarely have to prescribe medicines. It's interesting. I get called with patients all day long, and I haven't even used the Pfizer drug. In fact, I tried to use it yesterday, and a patient didn't want it because the patient says they don't trust Pfizer. So
interesting. That's funny. Well, okay. Another question that I was asking myself was basically, would you have done what exactly would you have done different in contrast to like Fauci or other people in power, if you actually had the power Fauci is having? What would it, or you could ask, what would a proper response to the pandemic have actually looked like?
Yeah, you're right. So I have more publications and more experience with Day Safety Monitoring Board than any of the federal officials. So I guess I am the person of authority in the United States. And I would tell them that we would have a four-pronged approach. So we would have the first pillar of the pandemic response. We'd have a team of doctors working to reduce the spread of the virus. The second pillar would be early treatment, a team on early treatment. We need a team on the third pillar, late treatment, and a team on vaccination. So we should have had 4 teams in Washington reporting to Americans at least once a month, And then we should have had a continuous review of all the data, on treatments and as things emerged on vaccines. And since we never had that quality, we didn't have the right organization, we didn't have high quality doctors working in Washington, doctors who were board certified, who were taking care of patients. We never had that level of quality. Our pandemic response has been terrible. Right. And so the doctors in Washington still don't even know what COVID is. They're not even aware of these advancements. They're not even aware of the virucidal random nasal washes and the randomized trials. It's been absolutely terrible. And with the vaccines, what happened is we should have had a separate group, a separate new entity lead the vaccine public program. And then it needed an independent data safety monitoring board, clinical event committee, and a bioethics committee. The FDA should have been the safety watchdog. The NIH should be the government research body, and then the CDC should be an outbreak investigation body. But instead, we have the wrong people leading the vaccine program. The FDA is leading the U.S. vaccine program with the CDC. That means nobody's watching after safety. To this day, we still have not had a safety report. Can you imagine that? They're a year overdue. Our first safety report should have been in February. They are a year late in reporting safety. Can you imagine when they discover that there's been 21,000 people have died after the vaccines? I mean, that's going to be quite a day in Washington when they discover that.
Well, yeah, that's pretty crazy. And, another question would then be, what's your honest prognosis on this whole thing? Maybe also from a political perspective, how is it going to continue? And maybe from a straightforward, logical, epidemiological, infectious disease perspective, because these are probably 2 different prognoses to make.
We just finished the very tall but narrow Omicron outbreak curve. There's not that many people left who are susceptible. There really are not. So I think we're going to see some low-level cases. I think the mass vaccination is going to prolong the pandemic. We'll probably have several more strains, but so far it's really been progressively more mild. The vaccines will remain obsolete. The early treatments continue to remain effective, and I think that's where we're going to go from here. It's too bad. I think a better scenario would be drop all the mandates, drop all the vaccines, declare an end to the emergency, and then just treat the occasional high-risk patient that we see, because we're going to do that anyway. So.
When do you think is that going to happen? Because that sounds like a very optimistic sort of scenario, which I think everyone with a reasonable mind and perspective on that topic would wish to happen. But even though I would like to be very optimistic about that, I currently, especially watching what is happening in Germany, I don't feel that optimistic about this exact scenario. So what do you think is the time frame that we're talking about?
It really depends on the leaders. In the UK, they just dropped everything. The UK is not that far away from you. They just dropped everything. So it really depends on the competency of the leaders. So if you have incompetent leaders, they're going to continue the vaccine program. That'll be a good litmus test.
Well, yeah, that's kind of seems to be the case here in Germany. To maybe be a
bit that's too bad. Germans are smart people, but you have to get your smartest people in charge of the public health agencies. Otherwise, you'll languish as a population. Yeah,
that's true. So, Dr. Peter McCullough, the final last question for you, and then we'll wrap up the podcast. Let me start here. It's been very frustrating for me to talk to my fellow medical students, and I already told one example about that topic, and hear also other experts and doctors discuss that, and make people panic even more, and shut down all the skepticism that people, or concerns that people try to basically to suggest, and deepen the split in society, making people hate each other even more. So it's been, crazy things going on. And so my question would be at the end, is there maybe some piece of advice that you would like to give to to the medical students, to the medical community, and maybe especially to students, to the young people who are listening to that? Because I've probably have some medical students listening to my podcast, and some of my friends who are the same age as me or in the same age group. And so for the young students, for the young medical students, for the young people, just is there anything you could tell them that you would like to tell them?
I would tell a medical student that in a time of crisis, you'll see a large number of doctors moving in one direction. You want to find the doctor who's outside of that group. You want to find the doctor who's got an innovative approach, because in the setting of crisis, the vast majority actually do not innovate. The vast majority do not have courage. The vast majority don't have integrity to actually follow the right pathway. And so don't follow the crowd, because in the setting of a crisis, it'll be a mistake. It's like it's some type of public panic in a square. Everyone runs in the wrong direction. You have to find the people who have the courage to stand outside the crowd and find the right direction. This was obvious. Find the doctors who learned how to treat COVID-19. Find the doctors who knew how to analyze vaccine safety and efficacy. The very first doctor who put a patient with polio on the iron lung machine was basically thrown off staff and castigated. The doctor in Austria, Germany, who said to wash their hands after delivering babies,
right?
He was castigated. You want to find those doctors. Right now, the doctors who have figured out how to treat COVID-19, that say they should use drugs in combination, are the same doctors that say the vaccines aren't working or not safe. You want to follow those doctors. Listen, I went on Joe Rogan, and do you know how many people have analyzed every word of what I said on Joe Rogan? And I showed up with slides, the citations, and you know what? They should analyze every word, because you know what? They're analyzing every word that I said because they're seeking truth. They're not analyzing other people. Do you know other people go on other podcasts? They don't get analyzed. I'm getting analyzed because I have the right approach. That's the reason why I'm being analyzed. Listen, I got to get going.
Well, yeah, absolutely. Thanks a lot for being on and for coming to the show. That's been really insightful. Okay. And so where can people find you? Just tell us where,
Oh, you can follow me on America Out Loud Talk Radio, The McCullough Report. America Out Loud Talk Radio, The McCullough Report. Everything I do is fully cited. It's very entertaining. We have music. We have experts that come on. Free interchange of ideas. You'll find the leaders in COVID-19 will be on the program.
Awesome. Okay,
thank you. All right.